Thus, UPSC has released a notification on Central Drug Inspector. So these posts are about 186 posts. So today we are here to gather on the demo session. So I will give some insights relating to the Central Drug Inspector examination. So the first thing most of the students are asking about the eligibility criteria based upon this age. Okay. So I got many queries from many of the students. Like some of the students are from they have passed out their B Pharmacy or M Pharmacy course long way back, and they're asking about whether they are eligible for this examination. So it is crystal clear mentioned in the notification, right? So a persons belong to unreserved category or EWS. That means these are the persons will comes under the open category. So the maximum age is 30 years. Okay, the students who are coming under unreserved category and EWS, that means economic weaker section, it is the age limit is 30 years. And for here, as this is a central examination, so you have the OBC reservation. So other backward caste persons will have the eligible that they can apply this exam for this notification for 33 years. Okay, 33 years. And if you have a reservation of scheduled caste, SC and ST, they can apply for plus Y relaxation is given, like they can apply this post for 35 years. And if they are having like economical weaker section, so they can apply up to 10 years of age relaxation is given for the persons who are belonging to those who are physically disabled person. So for OC, it is clear that 30 years if you cross, as per the notification which is released on June 25th. So at that point of time, if your age is crossing more than 30 and you are not eligible for this examination. But OBC, SC and ST, you can see the slide, and based upon this relaxation, and they can apply for this exam. And one more thing, if your age is 33 and you are not able to compete for unreserved and EWS category post, and you will be eligible for competing only OBC post if you are competing if your age is 33. Okay, so this type of the general reservations will work especially in the central examinations. Okay, now coming to the courses, like as this is a central drug examination, so the recruitment body, this notification is coming from UPSC. Okay, so Union Public Service Commission. So it is not like the state examination. There is a lot of transparency. The recruitment will go at very transparent manner. So once the notification is released, so the things will go it at very smooth pace. So getting 186 posts of vacancy, it's a very huge notification. Okay, because recently, like as there is the persons who are coming from the recent graduate, I see if you are in the pharma side or if you completed M pharmacy or B pharmacy recently, so this is a right choice for a person to apply for this examination, because you are in contact for the substance for this subjects for very closely you are in contact with subject. Okay, and the syllabus which is mentioned in the drug inspector examination, it is not that much hard like you have the syllabus for GPAT and NIPA. So you have the special defined syllabus, and most of the questions will be asking in that arena. So try to follow the syllabus very strictly, and what are the aspects that are comes under that particular syllabus. If you study those, then it will be easy for you to crack this examination. So it's not like that you will study all pharmacology or all pharmaceutics and all pharmaceutical jurisprudence. You have to strictly stick. You should be adhere to the syllabus which is given by the UPSC. They will not given the detailed syllabus, but based upon the previous experience of 2017 or previous central drug examinations, and have compiled for other state examinations. So based upon that, for the recent, what are the last 5 years drug inspector examinations, how the trend is followed. Accordingly, I have compiled that information and have put it in the slide. So if you focus on that area, it will be very easy for a person to prepare for this examination. And coming to the department, Central Drug Standard and Organization, CDSCO is the department who is dealing with this. And you know, this comes under the Ministry of Health and Family Welfare. And as already said, the total posts are 186. Coming to there, asking about the pay scale. What is the pay scale? It's a gazetted post of level 8. The salary, basic salary will ranges from 47,600 and go to 1,51,000. So when you club DA and TA allowances as well, and within the first month you will be getting at least 1 lakh per month you will be getting as a salary when you enroll yourself, when you get the posting of UPSC Central Drug Inspector examination. And apart from this application mode, they are inviting the application through online mode by the UPSC ORA portal. And application window is already open, which has started in 25th June 2026. And the last day to apply for this post is July 17, 2026. And window will be strictly closing at 6 p.m. Okay. And application fee will be very nominal. It's not like that they are charging more like when you apply for different TSPS examination where they charge where application fee is a burden, but the application fee is very nominal. It is rupees 25 for the person belong to general or OBC or EWS male. But for the women, they are not charging anything. It is nil for women. And the person belong to scheduled castes and scheduled tribes and physically challenged. That means SC, ST, physical disability and women. The application fee is free for application of this Central Drug Inspector examination. And most of the people are having the selection mode. First, it will be a screening round of like written examination. So this is the major hurdle. First, you need to clear your written examination. And apart from that, you have the interview as well. But the interview is not that much. If you score well in the written examination, that carries very high weightage. So you have the interview as well, but the marks allotted will be less. So most of the people who are clearing this written examination, definitely they will perform well in case of the interview as well. But 90% is the weightage. It depends upon how you perform in the written examination. So once you clear written examination and also the interview, then they will call for the document verification. And once your documents are fine for them, and they will ask for the call for the medical examination. When you pass these 4 rounds, like written examination followed by the interview procedure and document verification and medical examinations, and you are good to go to join as a UPSC drug inspector. And job location, as it is a central post, so you may, based upon the requirement, you can be working in pan India at anywhere in India. It's not that strictly that you will be working in southern states. So it depends upon the requirement, because central drug inspector post person will be posted based upon the vacancy allotted to that particular region. So you can be posted anywhere in India. But you will start in the career as a gazetted officer. So, and you think that because a person coming from the B.Pharm or M.Pharm, their final dream is if you want to settle in the drug inspector in the government side or industry side, or you want to settle in the government job. So UPSC, this drug inspector is a top level post that you are expecting over here. Because soon after completing the B.Pharm or M.Pharm, and soon if you learn as a UPSC drug inspector at a very young age, so it carry high weightage to your career, and you can start your career as a gazetted officer. And 186 posts is the huge vacancy. When we started in the year of 2011, there was a very cutthroat competition because the standards are more and there is people used to compete, and there is a lot of the competition was based. But the path is made easy because most of the people who are the seniors, they are already competed the exam. They are above 30. They are not competing with you. That is one of the reason. And almost the people are at the 35 or 40 or 36. They already settle in the industry side into the private sector, and they are at the different managerial position, and they have lost their contact with the subject for the longer period of time, and they are nowhere competitors to you because already they have their commitments in their life, and already they have 5 to 7 years of experience in the private field. Even they want to compete for this examination, the age is becoming a hurdle for them. When you look at state government examinations, it is giving the age relaxation up to 44 years. So at least they are taking some break, or they are taking some leaves, or they are working on Saturday and Sunday. Again, they are competing for this examination. But this age is a criteria for them. If you are a recently B.Pharm passed out or M.Pharm passed out, or you are working somewhere in the private sector in the pharma field, and if you are eligible to apply for this post, and if your age is, if you have a reservation or you are belonging to the OBC, And I request everyone try to give an attempt for this examination. You have some time right from the application start, your preparation from the day one. And because this is your subject, because you're into the pharma, and we will be covering this entire course is designed specifically, which is mentioned by the UPSC. If you work for 3 or 4 months with heartfully, definitely you will get this job. So don't think that 186 posts are less. 183, 186 posts, it's a huge vacancy, and you will not expect this type of the vacancy in the future. Okay. Now coming to the course highlights. Okay, we are starting from one-to-one mentorship. So, like, if you want to have the daily test, like, I will be a mentor for you, and if you want to take one-to-one mentorship, and based upon the syllabus, daily you have the, we will be have one and one two session in the morning, and we'll be giving some questions related to that particular topic. And apart from them, MCQs also will be provided. And I will be from the day one to till you write the examination, it may be 3 or 4 or 5 months. So I will be with you for till you give the examination for the drug inspector. So this is only for a person who is very serious and who want to shift their, who want to give the 100% dedication for the central drug inspector examination. So the one-to-one mentorship is only eligible for those persons. Okay, so that means you will be under the 360-degree monitor from on me, and you will be under radar of me, and everything, the notes and short notes, handouts, and every material, and we'll be regularly having the session in the morning, and day by day we'll track the progress of the candidate. So that is the beauty of this one-to-one mentorship, and we are taking only 15 members for this one-to-one mentorship. Once we cross the 15 admissions, and we are not able to take, because for evaluating the 15 papers for day by day, it will take a lot of time for me, because I'm also working in the sector. So that only 15 members who are very strict, and who are ready to spend at least 3 to 4 hours for this examination, try to enroll for this, and don't pay the money. And after paying the money, and if you're not reciprocating with me, it is waste of time. If you have a commitment that at least 2 3 hours right from the day one, if you want to dedicate for this examination, those person only take the one-to-one mentorship. It's like some of the people will pay the money, and till the notification they'll be asking, send me the recordings of those class. For those type of the person, one-to-one mentorship will not ever work, because we need to travel with you for a longer period of time till you give the examination. So those the serious students only try to enroll for this one-to-one mentorship. And apart from that, strictly it is a syllabus based. We'll be conducting the live classes. And if your time is a constraint for you, and if you're not able to attend the live classes, for those persons, you can install the JP Study Circle app. Once we complete the class, this entire class will be uploaded into our JP Study Circle app. And in the day, like before going to your bed, you can complete that class, and you can take. And apart from that, the running notes is also given, and the soft copy of that particular class is also given, and try to finish the syllabus on that point of time. Once we complete the class in the morning, then at least end of the day try to finish that class, so that it becomes easy for you to give the mock test in the coming days. So in order to track the progress of the students, it's not that we give the live recorded materials and soft copy of materials, and 10 mock tests we will be giving covering the entire syllabus. So this mock test, apart from that, this 10 marks test will be like a unit test. Okay, for 10 different topics, like we have segregated entire syllabus almost into 10 different topics. So that will be covering like pharmaceutical jurisprudence, like medicinal chemistry, or topics related to other pharmacology. Those mock tests we will be providing. It maybe from 150 to 200 questions will be given. And apart from that, for the quick revisions, most of the one-liners, what are the most expected questions based upon the previous drug inspector pattern, and those type of the handouts are also given, so that you can have a quick revision and have a quick glance before giving the examination. And apart from that, a completion of every section, we will be conducting the 20 sectional test. Okay. And apart from that, we'll provide the answer with the explanation. And if you have any doubts, we can keep a separate session on that. And there we can clarify your doubts if you have any doubts in that sectional test. And this 8 grand test, it will covers entire syllabus. It's like when you complete your syllabus and when you give the grand test of an examination, like for the central drug inspector, of if it is of 150 marks, mostly it will be the 150 marks into 300 marks. It will be the 150 questions which covers entire course of central drug inspector examination. So once you are giving the drug inspector when you are ready to give the grand test, so it means that you are ready with your preparation, and your syllabus of entire syllabus is completed from your side. Okay, so then it will become easy for you before giving the examination of the live examination of central drug inspector. If you at least practice it, you should practice 7 to 8 grand tests. Then only you can access your capability. How much we teach is not important, and how much intensity it has reached into your mind is very important, so that you can also check your competency with your peer members. So we'll be, once you enroll for this test, we will also keep the scorings in the WhatsApp chat, so that you can compare how other peoples are competing for the same subjects. And this 8 grand test, it's not only for the JP study circle, and we will provide this free grant steps for other institutes, for other people who are preparing for other drug inspector examinations in India wide. So there also will compete for this exam. It's a free test. So you can, it's not like if 15 or 20 students are joining the JP study circle, those only eligible for this 8 grant test. So we will roll out this grant test for entire, it will be open for all over India. Anyone can attend this examination. So then only you can able to see at what level you are standing in your preparation. Okay. And apart from that, I already committed that we'll be providing the recorded classes, and previous paper analysis also will be providing, and detailed syllabus analysis. That means like in the previously completed sessions, and what are the questions, what are the main focus areas that they have concentrated, that we'll be studying. And apart from that, what are the major topics or top 15 or top 60 high priority areas that you need to concentrate for these examinations, and those will be providing, so that it will ease your preparation. Okay, so for these examinations like pharmaceutical jurisprudence, it's carry high weightage, but this in case of other GPAT, the questions which are asked in the pharmaceutical jurisprudence may be less. But when you attempt for the state drug inspector examination or central drug inspector, so the question asked from the pharmaceutical jurisprudence will be more. Okay, so that questions that you need to study in depth, because you you'll show some type of negligence when you study in the B.Pharm or M.Pharm. Pharmaceutical jurisprudence is the last option for you. But when you compare for the competitive examinations, the most of the questions were asked from the jurisprudence jurisprudence topics as well. So last time when people have taught for the state drug inspector examination, they are the one who have not neglected the jurisprudence as well. At least 30 to 40 questions are asked in the last state drug inspector examinations, and the people who have concentrated more on the jurisprudence, specifically for the state drug inspector examination, they have secured very good rank in that examination. So I request everyone, don't neglect the pharmaceutical jurisprudence as well. And this type of analysis, well, we can able to see when you go for when you analyze the subject in depth, what are the major focus areas in from each subject, how many questions are coming. So what is the weightage which is given to the pharmaceutics? What is the weightage which is given to the biochemistry? What is the weightage which is given for other sections? Okay, so entire analysis that I have kept in the slide, so that you can able to see what type of the priority you need to give for your preparation. Okay. And apart from that, some people are asking whether soft copy is provided. Yes, after completion of each and every topic, we'll provide the soft copy of material. You can download it from JP Study Circle app, or if you want the hard copy of the material and it can be delivered to your home, then hard copy of material is also provided. And if you want to study in the PDF format, or if you want to take printout, and soft copy also will be provided after completion of the syllabus. And apart from that, for every topic, we will provide smart and queries and one-liners. So what are the take like major a type of gist and handouts will be provided, so that once after completion of the syllabus, and it will be easy for you to cover the syllabus in the short span of time. So it's not like how much depth level of the subject that you have studied, but before going to examination, how fast you can revise your subject is very important. So for taking that aspect into consideration, we will provide the handouts and one-liners, or it may be some MCQs on major topics, so that that core topics should be in your tip of tongue, so that it will be helpful for you to score good marks in the examination. And we'll complete the syllabus in time, and we'll be strictly concentrating on the syllabus which is more specific to the central drug inspector examination, and rather than teaching what we know of entire syllabus of the GPAT. Okay. The strategy for preparing this, maybe it may be central drug inspector, or maybe it is a state drug inspector. So what you should stick to the syllabus, because they provided some of the syllabus is very specific. If you study that, you can read the multiple books, but only the related to that specific topic, or if you stick to the syllabus, then it becomes easy for your preparation as well. Yeah. Next, coming to this, actually, according to the recent last drug inspector examinations, so they have provided the topics. These are the 13 topics they have mentioned. The first topic they have mentioned as basic knowledge in pharmaceutical chemistry. So let us understand at least this first day of this class. Let us study the complete, let us analyze what is the complete syllabus of the central drug inspector examination. So the problem with central drug inspector, it's not like a straight drug inspector. They will provide each and every topic wise syllabus. Just here they will provide you the headings and what are the topics are relevant to the topics that you need to concentrate. So that is the problem with this central drug inspector examination. But when you look at the straight drug inspector examination, and each and every topic subunit wise they will be providing, and it will become easy for a lecturer to teach those topics, and it is easy for a student to concentrate on that particular topics. Here just they will syllabus mention the content of the syllabus very broad. So it is up to you, you need to decide what are the topics or subtopics are coming under that particular topic. Okay. The first topic they have mentioned as basic knowledge in the pharmaceutical chemistry. So in the topics, we need to study about chemistry of drugs and their classification. Okay. So it may be related to major CNS, and major topic areas. We need to concentrate on this, like related to anti-inflammatory, cardiovascular drugs. So the chemistry of the drugs and their classification will comes under the basic knowledge of pharmaceutical chemistry, uses, mechanism, and pharmacological effects. Okay, this will be covered under this basic knowledge in pharmaceutical chemistry. Chemical classes and important drugs, and mostly you need to, in this pharmaceutical chemistry, you need to give more importance on structure activity relationship, because when I started analyzing the previous year questions, so most of the questions are asked based on SAR. So this topics you need to study in the medicinal chemistry angle. Okay, however, the topics related to the mechanism of action of different major system that you study in the pharmacology as well. But in this, you need to study in the context of medicinal chemistry. Okay, and the toxicological effect, drug interaction, and storage. So these will be come under the basic knowledge of pharmaceutical chemistry. Okay, so every classification, majority of the major system, it may be CNS or CVS, in that classification is must and should for this. Okay, structure activity relationship for this drug, you will be studying in this area of the first section. And next one, as a drug inspector, you need to have the second section. They have mentioned the knowledge in manufacturing and evaluation of pharmaceutical dosage forms. This is very important. In this entire syllabus is related to the pharmaceutics. This syllabus is related to the pharmaceutics. Majorly, they have concentrated on tablets, coatings, capsules, okay, powders, granules, emulsions, suspensions, ointments, creams, gels, parentals, sterile products, ophthalmics, aerosols, biologicals, biotech products, and evolution test and stability studies of this tablets and capsules and powders. Okay, so these are the major topics that falls in the category of pharmaceutics, and specifically you need to study in the context of pharmaceutical dosage forms. Okay, so this is the second topic. That means they are testing your knowledge in the pharmaceutics as well. So be specific to the topics which are mentioned over here. Okay, when I start analyzing the previous question, most of the topics are under related to the tablets, capsules, grams, creams, and biological products also, vaccine, sera, anti-sera, and related to the biotech products also they have asked for this. So related to the pharmaceutics, you need to consider on this because they will be mentioning only broad heading, knowledge in manufacturing and evolution of pharmaceutical dosage forms. So it is up to you. You need to understand these subtopics and prepare smartly according to that. And next, the knowledge in analysis of drug formulation and active pharmaceutical ingredients. So these third topics, they are mostly concentrating on pharmaceutical analysis. Okay, this is related to the pharmaceutical analysis as well. So it may be limit tests or some concepts of inorganic chemistry also covered in this. So limit tests, assay tests, titration, spectrophotometry, and the topic which related to the chromatography. Okay, high performance liquid chromatography, gas chromatography. So TLC, bioassays, microbe assays, sterility testing, pyrogen testing, endotoxin testing. So calorimetry, turbidimetry, and validation of analytical methods, because validation of analytical methods, there are asked many questions in the previous examination which are related to the validation of analytical methods. So these topics are also we need to concentrate more when we study about pharmaceutical, when we deal with the topics related to pharmaceutical analysis. And the knowledge on pharmacopoeias is also essential, like IB, PP, and USP, and impurity profiling and residual solvent. So this is the section, the third section, they want to test your knowledge related to the pharmaceutical analysis. Okay. So apart from that, as a drug inspector, the procedure involved in the collection of blood and preparation its components. So for checking, like for the inspection, it's not you work for them related to the manufacturing side. And we also once you join as a drug inspector, you need to test on some blood components and preparations as also some blood laboratories. Also, you need to go for some inspection. So they might be expecting the knowledge on related to the blood and its components as well. So last time when we attempted for even the state drug inspector examinations, the concept which are related to the collection of the blood and preparation and its components, it is also there in the state syllabus. Okay, this as it is also mentioned in the central drug inspector syllabus. So officially they have not released any official syllabus for as of now, but based upon the previous, like we have prepared the syllabus so that most of the things will be mostly similar to this. And if any changes is there in the syllabus, we'll be updating in the group so that you can follow the syllabus. Okay. So completed related to the blood and preparation of its components, you need to study about blood collection, donor selection, blood grouping, cross matching, anticoagulants and storage aspects related to the storage of the blood, and how you preserve the blood and blood preservation and safety techniques. Okay, the components, how you store RBC, plasma, platelets, cryoprecipitate, quality control, and aspects related to the transportation of the storage of the blood. So these are, see, the procedures involved in the collection of blood and the preparation of its components. So related to the blood components also, you need to have the thorough knowledge on it. And next one, I have already mentioned some knowledge related to the biotechnology also they are expecting, like procedure involved in the production of vaccines, sera, and biotech products. Because it's not only that you work on the retail side, some of the drug inspector may work on retail side and some may work on the manufacturing side. So you need to balance, you need to have the knowledge on both sides. So the process involved in the production of vaccines, sera, and biotech products also, like types of vaccines and their preparation, sera, anti-sera, antitoxin, immunology basics, okay, active immunity, passive immunity, okay, those type of cell culture and fermentation, which are to, and purification and downstream processing, quality control, sterilization, stability, cold chain and packaging. So process involved in the production of vaccines, sera, and biotech products. So these are also syllabus. They are also testing. They have kept this syllabus under central drug inspector as well. Okay, and knowledge related to good manufacturing practices. Okay, this is very important. Most of the questions will be asking related to GMP, like schedule M, different types of how do you follow the documentation, SOP, batch records, validation, qualification, quality control. Okay, related to production and process control, self-inspection, auditing. So these type of the good manufacturing practices is also included as a part and parcel of this syllabus. These are the syllabus you may not study in that much depth in B.Pharm or in your M.Pharm, but this good manufacturing syllabus topics which are related to this syllabus will also carry the high weightage, especially when you apply for the post like central drug inspector examination. See, good in the way of good manufacturing practices, the syllabus they have mentioned as good laboratory practices as well, JLP principle, lab organization, personnel, laboratory facility, SOP and documentation, how you manage the sample management, and how you keep your records like data integrity and record keeping, method of validation, quality assurance, audit and good documentation practices. So these are the good GLP practices, like good laboratory practices, good manufacturing practices. These are also the part and parcel of your drug inspector examination. See, same good clinical practices that have included like ICH and GCP guidelines, clinical trial phases, investigation and sponsor responsibilities, how you design the protocol and monitor protocol design and monitoring. So these are the bioavailability and bioequivalence, clinical trial documentation. So these are the topics we'll cover under the good clinical practices. So I'm stressing more on this syllabus, and at least I'm this part of the demo. You need to understand understand the syllabus first. So when you look at this syllabus is somewhat different when compare what you study. You study in the GPAT, it's more into the technical aspects. So that type of the syllabus is not as it is. The syllabus which you study for GPAT and NIPER is completely somewhat different in case of this examinations, like drug inspector examination, because see GMP technique and this will not carry more weightage when you work for GPAT. But here it will carry more. These topics will carry, see, bed procedure in bed components and preparation its components, procedure involved in the production of vaccine, GMP, GLP, good clinical practices. These are the subjects which carry the more weightage in this particular syllabus. Okay, you need to have some knowledge of investigational skills. It's like for sample collection, sealing, dispatch, and you need to have the knowledge on inspection techniques, search and seizure, evidence collection, interview and writing, root cause analysis, risk assessment, complaint investigation, product recall. So these will come under the knowledge of investigational skills. This is more related, this syllabus is related to practical oriented. Like once this syllabus will be helpful for design. Once you join, this syllabus will serve as a fundamentals once you join as a drug inspector. More and one either way, this type of the knowledge that you have accumulated during this examination preparation, at least it will provide you some basic idea in your field work once you join as a drug inspector. Okay, this syllabus is designed in some type of practical approach rather than dumping all theory that you are studied in the 4 year of B.Pharma. Okay, so now this is very important in the pharmaceutical jurisprudence section 10, which is related to the pharmaceutical jurisprudence. Drug and Cosmetic Act rules, licensing of manufacturing, sale, distribution, import and export, clinical trial rules, schedules. They have lost lot of questions and schedules as well. Cosmetic rules and medical devices rules. Okay, so Drug Price Control Act, Pharmacy Act. So most of the topics which are there in the pharmaceutical jurisprudence. Okay, it may be a schedules or it may be to the good licensing or manufacturing. Those type of questions are asked in related to the jurisprudence. Okay, so you need to study in depth, especially because this is the core area that you need to concentrate more, because most of the questions will ask on from this arena of the pharmaceutical jurisprudence. And apart from that, they have mentioned some topics related to basic principles of biopharmaceutics and pharmacokinetics as well, like ADME concepts like absorption, distribution, metabolism, and excretion. Concept related to bioavailability and bioequivalence, half-life, clearance, VD, okay, volume of distribution, kinetics, like what is zero order, what is first order, what is second order, like Michael Menton's constant, compartment models you need to study. This from the biopharmaceutical and biokinetics book, that is a wonderful book. You should follow that basis related to the biopharmaceutics and pharmacokinetics aspects as well. Okay, and these 12 and 13 sections, this will carry very less weightage for your examination. At least they will ask four to five questions, or almost not more than 10 questions will be asked from 12 to 13. So the basic knowledge of computer application, this will be very easy. They will test your basics on some computer fundamentals, some shortcut keys related to MS Word, Excel, and PowerPoint, like spreadsheets, like how you handle the spreadsheet, related to some basics. Okay, cybersecurity tasks basics, they will not touch that much in depth. Okay, basic fundamental concept. If you get some blue line, what is the reason? If you repetitive word, what color you will get? So those type of some shortcut keys. Okay, relate in case of MS Word and Excel. So those type and some concepts which related to generation of the computers. Those type of the aspects will be completed, and we'll be providing like a 13 or 15 pages PDF to you, and most of the questions, if you follow that 15 to 20 pages of the PDF, that will be more than enough to cover this syllabus which is mentioned and the basic knowledge of computer application. And next, coming to the English language, this reading comprehensions from vocabulary. They may ask some questions related to synonyms. They ask me questions related to some antonyms or one-word substitution as well. Okay, some error detection, some questions related to articles, preposition, some class tests like jumbled sentence. So most of the people from some antonyms related to antonyms, synonyms, one-word substitutes. Okay, some idioms and phrases. So these are the 4 and 5 core areas. Are some question related to articles and preposition. So these are the 7 areas you need to touch. So that will be very easy. Or we have some 30 to 40 pages of this English language proficiency that may be helpful not only for Central Drug Inspector. So it will be also helpful for in future if you want to attend for the state drug inspector exam as well. Because I say don't neglect this section. This section may carry less weightage maybe in the Central Drug Inspector examination, but if you have attempted any state drug inspector exam recently, they have asked a lot of questions which related to the English language proficiency as well. Okay, don't go blind. Don't think I am from the childhood. I am an English medium. I'm a student of English medium that I can attempt these questions. But still, at least 2 or 3 days dedicate your time for this English language proficiency also, because every mark will carry a weightage. It's not like that. Sometimes the deadlock situation, most of the people having the same marks. Like you may lose the job at 1 or 2 marks. So every section is important because 12 and that the weightage might be less, but at the end of the day, like within the one job, with the 1 mark, you can also lose the job. So don't neglect this basic knowledge of computer application and English language proficiency as well. So this is the general syllabus, like the UPSC, like for Central Drug Inspector, they will be providing. Like related to first one, it's related to your pharmaceutical chemistry. The second, which is related to pharmaceutic, dose pharmaceutical dosage form. Third one, which is related to pharmaceutical analysis. The fourth one related to blood products. Fifth one, vaccine, sera, and biotechnology related. And sixth, which is related to good manufacturing practices, good laboratory practices, and next, good clinical practices and knowledge of investigational skills. And the 10th one is totally related to pharmaceutical jurisprudence. And 11th one, which is related to basic principles of biopharmaceutics and biopharmacokinetics and basic knowledge of computer applications and language to test your English proficiency. Okay, so this is the entire syllabus. The only drawback is they will not give detailed syllabus. It's not only for the last drug inspector, it's been for many years. The syllabus is not very crystal clear. Just they will give the headings and the subtopics you need to decide, cleverly decide what are the topics will come under the topic, and accordingly, instead of reading entire thing, and you need to go with the specific what are the important topics will come under this particular exam, this particular topic. Okay. Now, once apart from this, from that syllabus, you can analyze like pharmaceutical, the weightage will be out of 150 marks. You can see the most of the questions which are related to the pharmaceutical jurisprudence. It's not like that. Apart from that, sometimes what happens, some of the questions they will go out of the syllabus as well. Okay, the majority of 100 or 150 questions you can expect pharmaceutical jurisprudence, pharmaceutics, pharmaceutical analysis, pharmacology, pharmaceutical chemistry. See, these are the six first 8 topics it already covered in our syllabus. Okay, see, pharmaceutical jurisprudence, most of the questions, the top weightage is given for these 4 subjects for Central Drug Inspector examination. Pharmaceutical jurisprudence, pharmaceutics, pharmaceutical analysis, pharmacology, and pharmaceutical chemistry. So these first 4 related topics are high priority sections for you. Okay, so most of the questions will be coming under this. And marks out of this questions, mostly there will be 150 marks question, and each question may carry 2 marks. So the total marks will be 300. So see, out of the 150 marks, 30 questions means it is carrying 20% of the weightage. See, that's why your first core priority should be pharmaceutical jurisprudence, then followed by pharmaceutics, third pharmaceutical analysis, then comes under the pharmacology and pharmaceutical chemistry. These are the top 5 areas. And one more thing, quality assurance and good manufacturing practices. This topic may be very simple. It may be a few topic, but the number of the questions asking from this area is more. Like out of them, you can expect at least 2 or because when you see the previous question analysis, the questions which are related to quality assurance and GMP, they have asked a lot of questions on this particular topics. Okay, so pharmacognosy sometimes very less questions will be there, and sometimes for some examination you may not find single question on this, but it will also at least your source level medical important constituent levels also you need to study related to for this like glycosides kind of thing are related to alkalides, those concepts, and what are the major tests which are there for identifying that chemical test. So those topics you need to understand related to pharmacognosy. Pharmacobiology, biochemistry, clinical and hospital pharmacy, regulatory affairs, and some topics related to some. There are 1 to 3 questions they'll ask about the current affairs related to the pharma. Maybe the recent FDA approved drugs. Like that's what are the drugs which are recently very got the permission without withdrawal from the market due to any side effects. Okay. So those type of any off-patent drugs which are related, which are the news which are creating huge noise in the market in the recent year. So those type of the current affairs, at least 2 or 3 questions they're also expecting from that. So keep updated with some type of the current topics which are making more noise in the market in the recent days. Okay. So this is the major entire syllabus for this. Your priority will be first 6 like pharmaceutical jurisprudence, pharmaceutics, pharmaceutical analysis, pharmacology, pharmaceutical chemistry, quality assurance, and GMP. So these are the first 6 questions will be should be your high priority areas because most of the questions are asking from those particular topics. Once you complete that and try to have the overview on other like pharmacognosy and microbiology, because sometimes the weightage it depends upon year on year. It's not like standard they are maintaining the same this as a blueprint. But when I start analyzing the previous drug inspector examination, so most of the questions are asked in this particular area. So accordingly, I has given this estimate. Okay. So this and the last few years of the questions are followed this trend. So I try to sort out this so that it will be helpful for you. Because most of the people might think for attending this examination, they will think the pharmaceutical jurisprudence will not have that high weightage. If you go for the traditional approach like what you study in the GPAT, then it becomes very difficult for a person to crack this examination because this competitive field, the syllabus is somewhat more practical. The syllabus is designed once you complete this and how this syllabus is used when you perform the duty as a drug inspector or when you work in the field. So in that level, this syllabus has designed so that you should be more specific while preparing this competitive with these topics especially. Now, most of the people are asking about the course details. What are the timings of this batch, whether it is an online batch or offline batch, and what is the teaching platform? And I got many queries from the students. What is the timings of this particular batch? What are the fee details and how we are getting the access to the recordings? So this question, this will answer most of your times. So the batch type, most of the batch time, it will be the online. Okay, we don't have any offline batch. We have only online batch, and the teaching platform is Zoom. So like today we have the session will be providing sharing the same Zoom link will be provided for entire 2 or 3 months of the course. And once anyone join through the link, will start the recording of particular session, and after the course is completed and of the topic is completed and we'll share the recording of that particular topic. Okay, the timings is 8:30 a.m. to 9:30 a.m. It starts from Monday to Friday. Okay, and Saturday and Sunday you will be having, see, per Monday to Friday you have the 1 hours of session 8:30 to 9:30, but Saturday and Sunday you will be having 2 hours of the session, starts from 8 a.m. to 10 a.m. like Saturday and Sunday. And if they are working professional, they are not having the time to attend the live classes. So immediately after the class, we'll record that class and I will save that class in JP Study Circle app. So you can download the JP Study Circle app, and from that you can access that class from that app. Okay. So the recording, once we completed the live class and soon on the end of the day or after completing of 1 or 2 hours, and the same recording will be providing that record, and that recording will be stored in the JP Study Circle app. From there you can access, because most of the people that run for the previous batches, most of the people are from employees. They may have some office hours at that per time, and the timing may not match. But some people have asked for the evening batch. It becomes very difficult. When I run from the evening batch last time, we have faced a lot of issue because that evening. I have some calls over in my company, and most of the people are not able to reach on time due to some traffic. So based upon the hurdles that you have faced in the previous batches, so I thought the morning batch will be useful for them. If they complete their batch morning 8:30 to 9:30, and after that they can go to the office. Okay, so that's why keeping that intention into the mind, we have kept for 8:30 and to 9:30 a.m. as a timing for Monday to Friday, and for the Saturday and Sunday it is 8 a.m. to 10 a.m. So coming to the fees particulars, it is 8,999. So actually we have kept for fees as 11,900. It is 11,000, but as a single payment, we have kept it as 8,999. With this, we will be providing this mock test, single or sectional test, grand test, or apart from that, the materials that we have providing for that, like soft copy and hard copy of the materials, that will be covered in under this entire fee, like a fee particular only. Okay. So I already said the recordings also available for you. Okay. Recordings will be available. So recommend, it's up to you how you allocate for your timings, because it's not like majority for in the pharmaceutical jurisprudence also. So first you need to understand what are the major focus area for your topics. Okay, the first your doses from like based upon the time allocation. What I have seen from the previous questions, like apart from the topics, most of the questions in the pharmaceutical jurisprudence, they have asked the question related to Drug and Cosmetic Act rules. Okay, so at least the preparation of 100%, 20% of the time you need to spend on this, because the question related to acts, rules, schedules, licensing, import, manufacturing, clinical trials, so medical devices and cosmetic rules. So based upon the schedules only and the licensing part, they have asked many questions. So Drug and Cosmetic Act, you should study about in depth. Okay, it's not like just you study about only schedules and acts and rules and go for the examination. It's not like in the GPAT we have studied for 5 pages notes, and that is very sufficient for this. But they are asking sometime, they are going asking about some penalties as well for this particular act. If what is the penalty imposition for that violation of the particular rules. So that means you need to go and study this Drug and Cosmetic Act rules in depth, especially if you want, if you are preparing for not the central drug inspector, and it's fast for the state drug inspector as well. See, then second priority area, dosage forms in like related to this pharmaceutic dosage forms and pharmaceutics care is very important. Same already we have mentioned tablets, capsule, parenteral suspensions, evolution test, sterile products and stability studies. So that your second priority should be this. And third, I already mentioned the previous slide, pharmaceutical analysis also. Different type of tests like SPLC, UV, IR. Some topics related to spectroscopy, you need to understand. Spectroscopy, you need to study the basics of the spectroscopies as well. Okay, pharmaceutical chemistry. So this syllabus is very as and not request everyone to go very in depth. The structure based question, when I see the previous year questions related to the pharmaceutical chemistry, they have not made went into lot of depth. Like what are the questions we expect in the GPAT related to the pharmaceutical chemistry? They are very high level depth question. So those type of the questions will not be expected in this drug inspector examination. Okay, this pharmaceutical chemistry, of course, it has weight, but this latest active related to structure, active SAR, structure active relationship, and some related to some structures. Okay, they have asked, but the level of depth they asked in the pharmaceutical chemistry, when I saw the previous paper, it was very like it was only 20 to 20% of the depth that which was asked in that the GPAT level. Okay, don't waste lot of our time and spending entire studying entire medicinal chemistry, or just have some peripheral idea on this pharmaceutical chemistry, because if you go and study, and if you want to study in depth with only the pharmaceutical chemistry, this part medicinal chemistry, it will kill out your 2 or 3 months of time. So you need to what to study, and you need to be very clear what to study and what not to study. Okay, because if you go and waste your time, this carry the 10%, but it may kill your 90% of your time. Okay. So GMP, GLP, GCP, you should be very cautious. These topics are very simple. You can complete in very small, in very less period of time. But this only GMP, GLP, and GCP, these are carrying good manufacturing practices, good laboratory practices, and these are carrying the good clinical practices. These are having the lot of, they are carrying more weightage. low syllabus and high weightage. So these are the topics which are relevant for this examination. You need to concentrate like GLP rules, guidelines, documentation, validation techniques, SOPs, audits, and compliances. Okay. See, pharmacokinetics also related to bio. I already said like ADMT techniques, bioavailability, off-life. Okay. This one compartment, two compartment model, bioequivalent studies. So those of this pharmacokinetic aspects also you need to study for this. Okay. See, vaccines and blood products. These are also, there are majority of the questions are asked in this examinations as well, related to the blood products answer, because as you, when you accomplish for, you will be allotted for the inspection, not only for the laboratories like manufacturing and medical shops, but also your for the blood laboratories as well. So that's why this syllabus is included on this. Okay. When you go for inspection of some blood laboratories as well, so like vaccine, sera, blood banking, recombinant products, cell culture, related to some vaccines also, sterility, cold chain. So this type of, on this topics also you need to have a thorough knowledge on it. Okay, investigational skills like how do you do the sampling inspection, how do you do search and seizure techniques like how seizure complaint handling, product, how you do the product recall, okay, report writing. So those are under will be under the investigational skills. Okay, so these topics may not be covered in the GPAT or NIPER level. Okay, but this will be very important. It's like an not so much of technicality is involved in this. A person who is reading for the first time, if you read for 3 or 4 times, there is not that much like spending. You should have a patience to study for to spend at least 3 to 4 hours when you study for spending 4 to 5 hours on this topics. It will how cleverly you will get the notes of that is very important. So it will not have that much technical aspects are involved in this, and it will be very easy. So we'll providing the handouts for this and try to go through that. And apart from that, some one-liners and previous MCQs also I will provide for this investigation skills. And if you go through that handouts, and that will be very enough for you to give this drug inspector examination. Computer on English already. The most of this out of this 9 or 10 sections, out of 80%, more than 85% already syllabus notes we have prepared for that. Okay, so already if you want to complete the syllabus in fast, or if you want to in the first 10 or 15 days, and the ready-made material is also available which is specific to this syllabus. Okay, I am expecting most of the syllabus for this time is also will be same, and if a new syllabus is added, especially in this notification of 2026, and I will add that syllabus to this syllabus, and I will provide the complete material. Okay, so 90% of this out of 9 sections, this 9 sections already material is ready. So it's only that you need to how fast you need to revise, because after completing the syllabus examination is not important for every section for this nine, and apart from that one's sectional test will be conduct the 10 sectional test, and you need to score well in the sectional examinations. Okay, so prioritize all 9 sections. It's not like that. You are getting more marks on drug and cosmetic rules. I will study and I will leave these topics. The only thing is you need to complete all the topics, but spend how the spending of the time is very important. Out of you are working for 100%, at least 50% of the time you should, the 50% of the times you should be on the first four topics like drug and cosmetic, related to pharmaceutical analysis, and pharmaceutical chemistry, and GMP, GLP, because near about 60% of the syllabus are coming from here only on the first 5 topics. Okay, so this also how much you want to read, like I already said what to study and what not to study is very important, especially when you are working for this competitive examination. Don't take your GPAT examinations like most of what the institutes are providing. They are providing 750 hours of lectures are provided. That 750 hours of lectures will not be, that will be, I can call it as useless, because that will be useful for your GPAT. It may be helpful for your NIPER. 750 hours if you are spending, it will take almost 6 or 7 months. So that will be, it will be not useless because you are not preparing for GPAT. B syllabus, I am not saying to join my academy or my classes. Wherever you are joined, ask them whether you are following the syllabus very strictly. That is the first question. Even if I am taking the class or somebody are taking classes, whether they are sticking to the syllabus, whether they are giving the coaching in line with the central drug inspector, that is very important. Okay, what we know, and if I know what I've studied in the previous, I've been teaching for 10 years, and what I know, everything, if I dump in front of you, it makes useless. Because when you are attempting the examinations, go to the syllabus copy, even you attempt for the civils, you are attempt for any examinations. So understanding the syllabus very important. You need to play in that syllabus only. Okay. And one more thing, try to spend your time on previous papers. Or if you have once previous central drug inspectors completed, go for the for this central drug inspector examinations, whether these if the same syllabus is there in the different state examination, at what level they are asking the question for that specific topics, then it will become easy for you to plan your preparation. Because just preparation I have made this MCQ bundle for this at least I have searched for the state drug inspector examination of more than 15 different for Jaipur, for different type of Ahmedabad. I have compiled those papers, and if the syllabus are common, the common topics are there, at what level they are asking their questions in that examination. So I am not saying that the questions may be repeated, but you can understand, it will be helpful for you preparing some MCQs for the grand test or sectional test. Okay. And apart from that, every section that we keep, it's not just we provide MCQs and answer and provide to you. And for every question that will be below the answer, we'll be providing the explanation. Then it will be very helpful for you to how apart from that, it's not you will get the knowledge of that question and why these four options are important for that question. And apart from that, when you go to the explanation, the core concepts are covered with our grand test, mock test, sectional test, and grand test. Okay. My request is, if the examination is there for 3 months, don't plan your preparation up to 3 months. I will complete my syllabus. After completing, I will give the test. That is the wrong methodology or wrong strategy. If you complete the drug and cosmetic this topic, try to give 2 or 3 examination on this. Okay, try to give the mock test on that and close that syllabus. And don't think in first 2 months I will complete the syllabus, in next month I will do the total MCQs. So the thing is, once you go on study, once you fall into the section 4, sometimes if you get a lot of interest in the subject, more than 1 point, some people will be out of the 3 months of the time, 90% when they fall in the chemistry, the person will be, it's like he will studying entire chemistry for that. And once after 1 month, if you see, a 90% of the syllabus will be on pending. Okay, that's why that is not the correct strategy. Give importance to each and every section. Try to complete the syllabus as fast as you can. Okay, don't wait for the class. And if you want to do your inline, suppose some other topics you have some time. So apart from what I'm teaching, if you want to add some topics to you and by your preparation, just add them also. Then it will become easy for you. Okay, but my strategy is I will finish syllabus fast. Like apart from that, if you are not in a position to attend the live classes, and I will finish the recordings and I will provide the material, and I will conduct the examination. And apart from that, I will provide the one-to-one mentorship for them. Okay. And one more thing, if you are very serious that I will attempt this examination with 100% efforts, then only those persons are eligible to join this academy. It's not like for somebody is asking, the notification has come, and don't waste your valuable money if you are not in if you don't have any interest for this. Okay, because if you're joining something, you are paying something 9,000. If at least 3 or 4 students will join, that's more than enough for me. If 10 or 15 joins, it's not a number is not a matter for me. But at least of the students who are joined, at least 10 or 15, I am expecting at least 70% to 80% success from them. Okay, it's been I am into the teaching for it's more than 10 years. It's not only I'm teaching for drug inspector, like I was a director of Akshara Pharmacy Academy, where we have completed 3 batches, where have some previous students are also attending this class, so are in class over here, and have taken some lectures. And presently I'm taking some lectures in case of B.Pharm, where I'm main faculty for pharmacology, like entire pharmacology I'm teaching over there. And I work for different platforms. And not only in this, I teach. I'm experience related to general studies, and general studies are related to. I'm a trainer for the Power BI, SQL, and Azure as well. So it's been, but specific to the karma when I competed in my pharma for the 2011, like NIPER, but still it's been 10 years and somewhere I'm being associated with the subject. Okay. So I request, and by looking at this, I am not asking to join my academy. Just listen for my classes. I will provide the 3 classes free. Try to compare these classes. Go and you have many institutes in Hyderabad. Pick up 3 institutes, attend their classes. If you find these classes are better than those, then try to join. And if you find, yes, the content that I provided, the studies that I'm treating, if other institutes are providing the better than that, and without any hesitation, that you can join over there. Okay, it's because you are paying something, you need to pick out best, like who is teaching better and who is following the strictly syllabus and who is there for you till the examination. These are the 3 points consider. If there's 3 points, and for this, it's like a just demo. I'm giving overview of because it's like a demo, but I have given the efforts. I put my efforts, like this is the syllabus, these are the topics they are covering, and this is the curriculum of the syllabus, and this is how we are following your next 3 months of the game plan. And next step will be directly, instead of giving this type of what are the key priority areas, and directly will be switching into the subject. Okay, if you're not able to join the live classes, you can join the listen to the recording, go to the 2 or 4 classes, and join other demo classes. May have many demo sessions has been enrolled in the last 3 or 4 days. Many institutes have conducted the demo. Attend their session, attend their live classes, and out of that, now take 1 day time, and then decide which is the best suit. And if you feel that confidence in your mind, if joining this academy will fulfill, I can with if you travel for next 3 or 4 months, and efforts should be my efforts, it may be any efforts will be 60% or 50%, and 50% effort will be from your side as well, because examination will conduct, but how many people will attend is very important. 90% out of the people will be starting. They will not. We are keeping the mock test, and almost sometimes I have 60 to 70 students when I give them for the Power BI training. Like only 7 to 8 students used to attend that. Okay, so there the intensity will be get diluted. But when you have decided that there will be one post out of 186 posts, one post is mine, then you need to struggle more. Okay, you have seen in the central state drug inspector of 18 posts, there are only few students. Like there are 4 or 5 posts. A lot of the people have competed from that, but here 186 is a very big figure. Okay, you will not get this much of big notification in your lifetime. Okay, utilize this wherever you want to join that, give 100% your effort, because most of the seniors are not falling under this age criteria. They are not at all competitors for you. The competitors are only Gen Zs, the only recent passed out. Now standards are very decreased, because when I'm teaching over here, like in the recent I'm taking some classes, but the previous students of the standards are decreased, very decreased, at least 50 to 70% are decreased nowadays. So the recent passed out students, if you have sincere, try to put your efforts more, because age as criteria only for OC. If they cross 30, they are not eligible for to write this examination. And most of the experienced persons also busy with this personal commitment. Even if they have an interest, due to their time and due to their office works, and most of the people might be get married, they may not focus that much with 100% efforts. And if you are recent passed out students, if you have a time, try to utilize this time and give the exam with 100% efforts. Okay, that's all I can say. And I will stop the recording here. And if you have any doubts, please stop the recording. Yeah.